via Zoom during the corona crisis of 2020. I am Dr. Frank Speidel, and welcome to The Doctor Is In. I'm a retired emergency physician and recovering hospital administrator. For what I will discuss today, I invite your robust doubt and skepticism. For as the great physicist and humanist Richard Feynman reminded us, science is the organized skepticism and the reliability of expert opinion. Dr. Feynman also shared, I would rather have questions that can't be answered than answers which can't be questioned. To Professor Feynman's invitation for skepticism, I ask we add astrophysicist Carl Sagan's observation. Extraordinary claims require extraordinary proof. Now, I am neither an epidemiologist, public health official, nor infectious disease specialist. Always defer for your healthcare guidance to your primary physician, your local and health state departments, and the CDC. Sadly, as I wrote the introduction to today's show, we had lost more than 318,000 Americans to COVID-19. You'll see some mortality rates to consider. I note that New York State is almost over twice the mortality rate of Sweden, which is comparable to the aggregate US mortality rate. Sadly, we may expect increasing deaths as COVID appears to be seasonal, as the other respiratory viruses are. But remarkably, in the midst of this most wretched time, we are gifted by the wit and work of the giants who walk among us. For we have seen the simultaneous development of not one, but two vaccines and others in the pipeline. This has occurred in months, not years. One by Pfizer has already received emergency use authorization by the FDA. The other by Moderna has been recommended and should be authorized by the time you see this show. All this occurring in the brief interval since the January publication of the SARS-CoV-2 genome. These vaccines are unique. They are messenger RNA vaccines. Instead of using the offending agent, the virus or a part thereof, to induce the immune response, the body is given the code, messenger RNA, to produce the target for the immune response, the spike glycoprotein. The produced target, the spike, then circulates and invokes an immune response. The basic research for messenger RNA vaccines began decades ago at the University of Pennsylvania. A principal in this research is Dr. Drew Weissman, MD, PhD. Now, not all of our responses have been as gratifying and welcome as this hyper-light development of vaccines is. Other responses we have seen include curtailments, abridgments, and closures. The spectrum of curtailment changes over both time and geography. For these abrasive reactions and actions, I have seen little consistent explanation of the rationale for such policies. Many of these policies and pronouncements invite questions, questions seldom addressed and rarely answered, such as, does aerosol transmission occur? If so, what are the implications? How significant is outdoor transmission? How about fomite transmissions? How many documented reported cases are there of fomite transmission? What are the implications? Have we created policies without discussing and answering these questions? Have we created policies to fulfill slogans such as control the virus that are politically attractive, naively admirable, but undoable? Have we considered fully the consequences of these policies? Now, one of these policies involves schooling. School policies range from closures to delays to modification of schooling to include virtual schooling, in-person schooling, and hybrids of those above. To my reading, medical literature overwhelmingly supports the safe return, quotation marks around safe, to in-person schooling, and has for a while. I note that safe is not a binary concept, but a spectrum. Is it safe to fly in a plane? Now let's consider the following articles. There are myriad. There is a Soray Barbe article, Pediatrics in May, addressing the dynamics of infections in families. There's the Levinson article, the New England Journal of Medicine in July, arguing for the reopening of primary schools during the pandemic. There's the Monroe article in Archives of Diseases of Children in May, boldly headlined, "Children are not COVID-19 super spreaders. Time to go back to school." Then there's the article by Beth Rosica in Pediatrics in August. COVID-19 transmission in children. The child is not to blame. On this show, I have been fortunate to have massively credentialed and recognized individuals from world-leading medical institutions, and I have asked them, should we reopen schools and get kids back in person? Both Professor Paul Offit of Penn and Professor Martin Kulldorff of Harvard unhesitatingly affirm school opening in person. And even though he hasn't yet been a guest on The Doctor Is In, Dr. Anthony Fauci weighed in on the topic of school openings, recommending close bars, open schools, as has the American Academy of Pediatrics. Now, despite these clear opinions from solid sources, school opening seems controversial. Throughout the country, schools are opening and closing. Policies tumble and swirl like the spin cycle on an overloaded dryer. Pennsylvania is no different. In August, Chester County recommended school openings be virtual. Our guest today is Beth Rosica, a doctor of education, resident of Chester County, and an advocate for in-person schooling. Dr. Rosica eloquently and insightfully has identified virtual schooling as being regressive, hurting the already marginalized while marginally affecting the affluent. Her comments on the regressive effects of virtual schooling exactly reflect the comments of our preceding guest, Harvard professor Martin Kulldorff. When very bright people of differing backgrounds independently come to similar conclusions, we ought to listen carefully to what they say. I am delighted to have as our guest today, Dr. Beth Rosica. Dr. Rosica, welcome to The Doctor Is In. And what did I get wrong in my introduction?
Thank you so much for having me on today, Frank. And I think that you've described everything accurately.
I'm curious, you have a doctorate in education, but you run a consulting business. I thought you were in consulting. Why the doctorate in education?
Well, Frank, I started my career over 30 years ago in the human services field. I worked for an agency called Vision Quest, and they provide treatment services to at-risk kids all over the country. I started my career with them as a teacher, actually in a program in the Chester Upland School District. It was an alternative school to help kids who were struggling. And as I progressed within the agency, I felt like it would be helpful for me and for the company to have a higher level of a degree. And so I pursued a PhD in education to really bring the best teaching methodologies to the young people in our care.
I apologize. I labeled you as a doctor in education, but you have a PhD in education, which is a different degree.
Yes, well, it's all referred to as a doctorate, so that's fine, Frank. Thanks.
That's the worst thing I do today. I die a happy bear. As a layperson, an extremely well-read and bright layperson, do you think children are super spreaders?
No, Frank, I do not think that children are super spreaders. And all of the research that I've read, many of the articles that you referenced earlier today, indicate that spread is not happening, transmission is not happening in schools. Even if you look locally in Chester County, it does not appear that the schools that are open and functioning, that children are spreading the virus. Most of what I've read is that if children end up testing positive when they've been in school, they did not actually contract the virus while they were at school. It was contracted somewhere outside of the school space.
I've heard that from so many of my guests here, and I am thrilled, sincerely thrilled, when someone who's out in the community, you don't normally travel in the worlds of medicine, repeats the evidence so well. That's a gift. So what do you think? Should schools be open and in person?
Well, absolutely, Frank. And this is what I have been advocating for since April. I began my letter writing and my campaign to try to get schools open back the first week in April. If you will recall, I'm sure most parents do, March 13th was that fated day when the governor shut all of the schools down, originally for 2 weeks. And here we are, 10 months later, and many schools are still not open. In the beginning of April, I reached out to our governor and began my letter writing campaign to, implore him to reopen schools because of the unintended consequences that we were surely going to see as a result of schools closing. And as I said, here we are many, many, many months later, and we are not making the kind of progress that I would like us to make. I have been fortunate through all of my advocacy efforts that I've met a great group of talented parents here in Chester County who are equally committed to getting schools open. And we have been working tirelessly over these months to try to educate our community and to advocate with our officials to, get our kids back in school 5 days. And really 5 days for those families who want in-person education. We recognize and understand that there are parents and there are family situations that may preclude a child from being in person. And every school district in our state has offered a 100% virtual option for every student. And so for those students, they have that option that they want. For those families, they get the option they want. But for those of us who want a 5-day option for our children, we do not have that option right now.
That's kind of scary, isn't it? Our country has this tradition of individual choice, which I think is a very healthy thing. Why do you think it is that it's so hard to get people to buy in on the concept of choice?
Well, I think that part of it is irrational fear at this point. Honestly, I think that our government and I think that the media has scared people beyond belief that everybody is just frightened. I testified at a Senate majority hearing in July to talk about how we could safely reopen schools. And there were 2 school superintendents at the hearing, and both of them talked about the liability, that they are afraid of a child getting sick or, God forbid, passing away from this virus as a result of contracting it at school, and they're afraid of being sued. And what was really sad at that hearing is that when I testified, I said that as a parent that I would sign a waiver that holds the school district harmless if my child gets sick or passes away from the virus, that I would not hold them responsible. And that was still not good enough. And most recently, the legislature tried to pass a bill that would hold school districts and other businesses harmless as long as they had demonstrated, reasonable efforts to mitigate transmission, that it would hold them harmless. And our governor vetoed that bill. So again, more evidence that there's something more going on than just people being afraid.
You raise a fascinating, neglected concept. For a long time, we as a society and as individuals have embraced the concept of individuals deciding on risk and benefits. Mm-hmm. Our risk thresholds and the benefits we perceive are different, individual by individuals. Is it safe to skate on a frozen pond? We all have different thresholds on that. Is it safe to ride in a car? I can show you. In 2 years in Chester County, deaths due to motor vehicle accidents increased 91%. Now, I abuse the statistics to get that, and you can do that. There is literally courses you can take on how to manipulate data. I took one time, and you pick your endpoints, and if you can pick your endpoints and you make them small, you can show anything you want to, like that 91% does. But that scares people. And I could easily start a campaign. We've got to do something about cars in Chester County. That's not the way we live. we live by understanding that there are risk-benefit trade-offs. The concerns, somebody will get COVID while attending school, and there's a chance somebody will die. Absent significant age and absent significant comorbid conditions, those chances are diminishingly small. Yet we are destroying young lives with this. Now, I sort of wandered. What are the unintended consequences to these school closures?
Well, Frank, this is what my biggest concern is, and we are already seeing dramatic unintended consequences of not having kids in school. So aside from the obvious, and the articles are out week after week after week in terms of the academic decline that is currently happening, anyone in education knows that the best education occurs in person for the majority of children, because if that wasn't the case, we would have moved to an online platform a long time ago. We have the technology to be able to do that. And there are some kids who do better in online remote learning. I've talked to parents whose kids are doing just fine, and I'm happy for them. But for the majority of students, being in person is the most important and the most effective way for them to learn. So we're already seeing academic declines. We're seeing kids failing classes that haven't previously failed classes. We're seeing skills that they're losing each and every day. But even more important, beyond these academic losses, we're seeing that child abuse reporting is down 31%. And I want to repeat that because I did not say that child abuse is down 31%, child abuse reporting, because we know that so often child abuse reporting is being done in schools because our teachers are trained, they know their students, and they are on top of when something doesn't seem right. So we are seeing a decline in child abuse reporting, which means that we have more children in our community who are suffering from child abuse that is not being reported or connected. And as an aside, we recently had a very tragic case here in Chester County with a little 9-year-old girl who was beaten so severely. And our district attorney was quoted as saying that all adults in our community need to have mandated reporting training on child abuse because with schools closed, we all need to be hyper vigilant. And I actually wrote to the district attorney and said, I think that you're advocating for the wrong thing. Well, I appreciate your efforts to try to make sure that this doesn't happen with other children. If schools were open, I don't think that we would be seeing these kinds of issues happening at the same rate. Certainly child abuse occurs all of the time, but our teachers are the ones who are really trained to identify and report this information. So child abuse is a big issue. We're seeing more suicides across the country. The last several weeks, there have been 3 that have been in the national news of young children. And we're seeing more suicide ideations. We're seeing depression. We're seeing isolation. We are in a mental health, a public health crisis as a result of schools not being open for our children. And my biggest concern is that in this time when social justice and equity are of paramount importance, our low-income children are being the most adversely affected. Philadelphia School District remains virtual as they have for the entire school year. And we have so many children there who may never recover from this time of being remote and from the academic deficits that they're experiencing. Here in Chester County, in particular, I live in the Westchester area school district. I know that every child has a device. I know that every child has internet because our district has made sure that that happens. And we live in an affluent enough area where that is possible. In the city of Philadelphia, you have children who 4 siblings are sharing a device. They may not have internet access. So these children are going to fall further and further behind, and there is a possibility that they will never catch up. And that is the public health emergency that we are seeing in front of us.
Beth, you are the Christmas gift, the holiday gift for so many. You are so spot on your observations. I humbly add the following comment. In decades in the emergency department, I became aware that a child may have one or two functioning adults in their life and they are not at home. That may be the teacher they have in school when they attend school, and that schools may be the source of the one solid source of nutrition in some of our more depressed areas. Taking the child out of this environment is wicked, cruel, and stupid. I'm sorry, I hope I don't offend people with that, but it is. And I thank you for your advocacy. Have school districts been uniform in their approach to returning to school in the Commonwealth, in the counties?
No, it is really different across the state. And here in Chester County, it's different. It really is different district to district. And I think that early on in the summer, I know that the districts in Chester County were meeting and they were trying to have some sort of uniform way of approaching this. And as the summer wore on and the guidance from various state and local agencies started coming out, it became clear that everybody was kind of going to do their own thing. And there's very little consistency as to what's happening. And I'll give you an example. Montgomery County, their county commissioners made a decision that all Montgomery County schools would be closed for the first 2 weeks in December following the Thanksgiving break. Thankfully, Chester County did not follow the same suit, although some school districts in Chester County made that decision, Westchester being one of them. So there really is no uniformity between school districts. You have school districts who have been virtual for the whole year. You have districts who have attempted to bring back kids more frequently. So the Wissahickon School District started the fall 100% in person for elementary kids. So those kids who wanted to come back, they were in school. They've been in school 5 days per week. So that was a very different approach than starting remote or starting this hybrid model. So it really varies school district to school district what's happening.
What about between states? Is there a similarity between Pennsylvania and say Florida?
Yes, well, so, the difference between Pennsylvania and Florida is that the Florida governor ordered every school every school district in the state to open. And you take that compared to Pennsylvania, where our governor, who most recently, and I'll read you his quote. So prior to Thanksgiving, he said, quote, "In-person learning is the best possible scenario for children, especially those with special needs and from low-income families." Yet several days, maybe a week later, the state put out an attestation form that every school district and the president of the board was required to sign that basically said, we are following all of the mitigation efforts in order to be safe, and we will comply with every edict that is presented before us, or we will go 100% virtual. So the governor says that the best place for children is in school, and yet the Department of Education and the Department of Health continue to promulgate rules that make it next to impossible for schools to open 5 full days for those families who want it. And interestingly, as an aside, there's a school district, Butler Area School District, their school board has sued the state over this attestation form. And I applaud their efforts because sadly, I think that the only place that all of this will ultimately get dealt with is in the court system.
Sometimes. What do you, how have you found the county and Commonwealth about discussing and explaining these recommendations and attestations?
The state is not forthcoming about anything. I've reached out to the head of the Department of Education, to the Department of Health, to the governor. Nobody responds. Nobody gets back to you. Here in the county, I have reached out to county commissioners and I've reached out to the head of the Chester County Department of Health. And they at least have engaged in dialogue with us. I will say that we don't all agree on all of the issues, but they've at least been responsive. And most recently, the Chester County Department of Health, we have met with them twice, and they have been more receptive to the information that we've been providing about the unintended consequences of school closures.
You've just been such a wonderful education, but I am overwhelmed by your advocacy. I can't thank you enough for all the things that you've done. You're a role model for many young people as to what the good things are to fight for. We get wrapped up in the superficial so many times, but the future of those who will follow us, providing them an environment that I love safety more than anybody, providing them an environment where they are safe and they grow up and they have all the experiences they need to participate in this world, to be the next set of developers at a hyper light speed of vaccines, to be advocates for those who have no voices. This is so, so vital. Before I completely close, is there any other comments you'd like to make, Beth?
Sure, thanks, Frank. So you talked earlier about assessing risk, and I think that that's really an important note that we could close on. So part of my consultant business, I also work in risk management, and I help agencies address risk. And this to me is such a big issue in this situation because we all take risks every day. You know, we have horrible things happen in schools like Columbine. We see school shootings. We never know day to day when you put your child on a school bus, ultimately what those risks are. But yet all of us every day, for the most part, go about our life. We send our children to school. We let them ride bicycles. We let them, go ice skating. And for the most part, everybody is safe. Yes, there are sad and horrible things that happen all the time. But for me, I would rather accept the risk of potentially exposing my child to a COVID virus and having them go to school and lead as normal a life as possible with all the precautions that we need to take. And I know that a lot of people say to me, well, it's not about the kids, it's about the teachers. We have to keep the teachers safe. And I agree with that. Certainly teachers are at a different risk level than its students, but I believe that our schools have the capacity, have the skills and the intelligence and the money to be able to keep our teachers safe. And if they have a precluding issue, then they could potentially work in the cyber option. So that's all we're looking for is a choice. We cannot continue to live this way for months and months longer. There's just too much at stake.
When we began this show, I shared Carl Sagan's observation that extraordinary claims require extraordinary evidence. I think we can reasonably say that extraordinary actions require extraordinary evidence. We have seen some extraordinary actions, I think you would agree. Shutting schools, locking down society was the consequence of crushing businesses. Such actions may be necessary and appropriate, but I think the evidence must be sure. Such actions should arise from science, ruthlessly and openly discussed, not from fear and politically facile slogans. Such actions deserve discussions, not disdaining dismissal, as we've been experiencing at different levels. This is not Oz, and we are not munchkins. And the great Oz has spoken is not an answer. Out there, stay safe, and thanks for watching The Doctor Is In. And Dr. Beth, thank you so much for everything. Role model and advocate. Be safe.
Thank you.